there was a particular one that stays with me. I asked this parent of an adult child who was dying if I could pray for him, and I prayed for him and his child over the phone. As soon as I finished praying, he started praying and prayed for me. And that was where, there's my tipping point that, my eyes filled up and I was overwhelmed with emotion, because in the midst of this, he found the strength and the conviction of his own faith to offer a prayer for me in the work that I'm doing. We do so much of our consoling people in person just by being able to nod or be present for them and to physically, be close enough to them that you don't have to say words, because you just sit with them in that, supportive silence. That's what's really hard over the telephone, is I'm finding not being able to visualize the person really, and have them be sort of inconsolable. And there's no perfect words at that time. There's only, the best that you have to offer, and to even just listen to that silence or those sobs, and then, respond in a comforting way. So that's been a newer, more regular practice for me. It's been a learning for me, really, and I talk about it with the other chaplains, and we kind of share our ideas, because most of the patients that we're seeing are really very sick, so they aren't able to interact in a conversation or anything like that. So the majority of them we offer prayer for. We ask the family what might be comforting for the family or for the patient's spiritual needs. Sometimes that might be, for a Roman Catholic, that would be the sacrament of the sick, which we have been providing, again, through a phone connection. We have the nurse or one of the people who is generally going in the room, or sometimes it's connected even with a family member on a conference call, and the priest calls and we hold the phone up to the patient's ear, and he offers the sacramental prayers for the end of life. Some people might just say they really want a prayer. Others might say, I'm really all set. There's nothing else that, needs to be provided for my loved one, which is perfectly fine. There are all kinds of ways to support families. It's not strictly through a religious tradition, but it's really through spiritual support.